Hello, my name is Aaron Munns. I'm the Veterans Director at the Mesothelioma Center at Asbestos.com, and welcome to part 3 of 4 segments training videos designed for veteran service officers assisting veterans in filing asbestos-related disability claims with the VA. In segment 3, we're going to be discussing medical nexus statements for asbestos-related diseases. If you watch segment 1, Components of Asbestos Diseases, you know that the VA recognizes several different medical conditions, including several different cancers that can be caused by exposure to asbestos. In segment 2, the VA decision criteria, you know that one of the challenges is proving to the VA that the medical condition or diagnosis that the veteran is suffering from was caused by exposure to asbestos. In this training segment, we're going to cover how to provide medical evidence to substantiate an asbestos-related disability claim with the VA. As we know, we must include a connection between the veteran's current diagnosis and asbestos. This is going to be expressed in the same wording as all the other nexus statements that you've worked on. Obviously, we want the doctor to be able to say that the veteran's diagnosis of lung cancer is due to exposure to asbestos, or more likely than not, due to exposure to asbestos. And at a minimum, we want the doctor to be able to say at least as likely as not due to exposure to asbestos. We also want the medical specialist, the doctor, to include a medical rationale for making their conclusion. And we want that medical rationale to be evidence-based. We want the doctor to be able to refer to CT scans or MRIs that show asbestos damage or scar tissue or fibrosis in addition to the diagnosis that they're talking about. A pathology report is required for any type of cancer taken from a tissue biopsy, which shows the specific cell type of the cancer, where the doctor can say that the etymologies for that specific cell type include asbestos exposure. We also want the doctor to be able to reference that the diagnosis is consistent with the latency period of asbestos, which again ranges between 10 and 45 years or more, and that is consistent with when the veteran was exposed to asbestos during their service. The doctor can't say that the veteran's lung cancer was caused by asbestos exposure during their service in the Navy, but he can say that it was exposed to asbestos approximately 40 years ago in the 1970s, which is consistent with when the veteran served in the Navy. One of the most common cancers that is caused by asbestos is lung cancer. However, only between 5 and 8% of lung cancer cases in the United States are caused by a combination of asbestos or asbestos and other risk factors. So one of the things that was determined about 30 years ago was the Helsinki criteria, where doctors from around the world came together to help doctors to establish a criteria that would help doctors identify when a respiratory disease or lung cancer was caused by asbestos exposure. The Helsinki criteria states that first, the disease has to be consistent with the latency period of asbestos. So in this case, lung cancer must have developed at least 10 years after the initial exposure to asbestos. For the veterans that we primarily work with, they all meet this criteria. The average age of veterans that I'm working with is their late 60s to mid 70s. So they were exposed to asbestos in the late 60s through the late 1970s on average. That is within the latency period of asbestos. There also has to be evidence of asbestos exposure. And the strongest link is if there is a diagnosis of an underlying asbestos lung disease, such as asbestosis. So if the veteran has asbestosis pulmonary fibrosis, is diagnosed with that, and then is treated subsequently with lung cancer, there is a direct medical link between asbestos lung disease and now lung cancer. Many veterans are not diagnosed with an asbestos lung disease prior to being diagnosed with a cancer such as lung cancer. So if there are higher than normal asbestos fibers in the lung tissue when they do the biopsy, or if the veteran has surgery to remove a lobe or a segment of their lung and it shows asbestos fibers in that tissue when it goes to the pathology lab, that shows direct medical evidence again of a connection to asbestos. Or if the veteran worked in an industry which has high known exposure to asbestos, like working in a shipyard or doing insulation work or repair work aboard a Navy ship, that would meet that criteria as well. So for all of the other cancers, the same criteria applies. So if a veteran has kidney cancer or intestinal cancer or colon cancer and they're trying to establish the link between asbestos and that cancer, typically if there is evidence of an asbestos lung disease, they can make that connection that although we didn't find any asbestos fibers in the colon, because the veteran has asbestos fibers in their lungs, it is likely that the colon cancer is also caused by asbestos exposure. Now, asbestos exposure does not need to be the only risk factor. Many of the veterans that we work with had a history of smoking during their service or throughout their lifetime in addition to asbestos exposure. So the doctor doesn't have to say that asbestos is the only cause or that they are 100% sure. Just that it is at least as likely as not that asbestos is a contributing cause of this particular diagnosis. If you have questions or need information, medical studies, or research to show a connection between a particular diagnosis for a veteran you're working with, please contact me. You can reach me at my email or give me a call. Please let me know if I may be able to help. And watch part 4 of our series on asbestos exposure summaries.